Aphasia. Aphasia is the loss of ability to speak, understand, read, or write a language. The problem is because of brain damage, usually after the stroke. But this is not a problem due to the speech muscles, like that occurs in dysarthria. Aphasia is classified based upon the speech and comprehension, that is, whether the speech is fluent or non fluent, and the comprehension is intact or if the comprehension is impaired. If the patient is having a speech which is non fluent and the comprehension is relatively intact, then we can say that the patient is having Broca's aphasia. If the speech of the patient is non-fluent and the comprehension of the patient is impaired, then the patient is having global aphasia. If the speech of the patient is fluent and comprehension of the patient is relatively intact, then we say that the patient is having conduction aphasia. If the speech of the patient is fluent but comprehension of the patient is impaired, then the patient is having Wernicke's aphasia. Broca's aphasia, that is expressive or motor aphasia. In Broca's aphasia, the lesion will occur in the inferior frontal gyrus. The artery which is affected in Broca's aphasia is superior division of left middle cerebral artery. The speech of the patient will be non-fluent, slow, and broken. The comprehension will be normal, that is relatively intact. The repetition of the patient will be impaired, and the patient will be aware and prostrated. Here is a memory tip for Broca's aphasia. Broca's is a broken speech. Also, you need to know that B is for broken and bitter, that is, the patient is prostrated. Now, let's discuss the global aphasia. In global aphasia, the region will be large and the areas which are affected in the Broca's and Wernicke's aphasia are also affected, as well as the arcuate fasciculus are affected. So in global aphasia, the Broca's area, the Wernicke's area, and arcuate fasciculus are affected. The speech of the patient will be non-fluent, that is, the patient will be mute, and the comprehension, that means the understanding of the patient, will be very poor. The repetition will be impaired, and the patient may use gestures or sounds. The next aphasia is conduction aphasia. In conduction aphasia, the lesion occurs in the arcuate fasciculus. The speech of the patient is fluent. The comprehension, that is the understanding of the patient, is normal or comparatively intact. Repetition of the patient is poor, and the patient knows they are making errors. The memory tip for conduction aphasia is the connection is cut, C for conduction and C for connection cut, between the Wernicke's and Broca's areas. And what is the connection? The connection is arcuate fasciculus. So the patient is fluent, understands, but can't repeat. Wernicke's aphasia, also known as receptive or sensory aphasia. In Wernicke's aphasia, the lesion occurs in the superior temporal gyrus. The inferior division of the left middle cerebral artery is affected. The speech of the patient is fluent, but that doesn't make sense. The comprehension, that is understanding of the patient, is impaired, repetition is impaired, and the patient is unaware of their mistakes. The memory tip for Wernicke's is wordy but wrong. Alexia without agravia. In this condition, the lesion occurs in the corpus callosum, usually in the left splenium. The speech of the patient is normal over here. Comprehension, that is understanding of the patient, is also normal. The patient can write, but the patient cannot read. So when the patient can write but cannot read, so we say that the patient is suffering from alexia without agravia. The memory tip here is the patient writes right but reads wrong. Writes right but reads wrong. Callosum cut the connection between seeing words and understanding them, so the patient can't read. Now let's discuss some of the questions and try to answer them. A 62 years old man had a stroke. He talks a lot, but his words make no sense. You ask his name and he replies, "The sky walks with shoes tomorrow." He is smiling, not bothered, and does not understand your question. He can't follow the commands either. So the patient is having a type of aphasia which is And the answer is Wernicke's aphasia. Here, the clues for Wernicke's aphasia are that the patient speaking is fluent, making no sense, there is no comprehension or understanding, and the patient is also not aware of the problem. Let's discuss the second scenario. A 70-year-old woman tries to speak after a stroke. She understands you perfectly but gets frustrated when she can't respond. She tries to say, I want water, but only manages wa, wa, wo. That is, her speech is slow and broken, but she understands everything. Here in this patient, the patient is having a type of aphasia, which is, and the answer is Broca's aphasia. Here the clues for Broca's aphasia are can understand, broken speech, and frustration. The third scenario is a 60-year-old teacher is recovering from a mild stroke. She understands you and speaks fluently. But when asked to repeat the word refrigerator, she struggles and says reflect, refrig, no, refrigerator. She knows it's wrong, but keeps trying to fix it. So, in this case, the patient is having a type of aphasia, and that aphasia is conduction aphasia. The clues for conduction aphasia is the patient is having fluent speech, can understand, but can't repeat, and she knows that she is speaking it wrong. Let's discuss the fourth scenario. A 65 years old man after a large stroke sits quietly. He can't speak, can't understand, and only make grunting sounds. He does not follow commands, and even simple words don't get a reaction. He communicates only by pointing or gestures. So the type of aphasia in this patient is global aphasia. And the clues for global aphasia in this scenario are severe loss of speech and understanding, silent or just sounds, and there is no repetition or comprehensions, that is understanding. Let's discuss the last scenario in this lecture. A 55-year-old professor writes a full paragraph clearly, but when you ask him to read it back, he stares blankly. He says, I know, I wrote this, but I can't read it. He understands speech, can write, but can't read. Not even his own writing, as in this case. So, the type of aphasia the patient having in this scenario is called alexia without agraphia. And the clues for alexia without agraphia in this scenario are that is, the patient can write, can speak, can understand, but can't read.